Well, welcome back, and joining us from our friends at CHI Memorial is Dr. Lee Jackson this morning, and he's going to give us some information on prostate cancer awareness. It's that time of the year again. You're going to help us know everything we need to know, right?
I will do my best to do that.
Dr. Jackson, thanks for joining
Sure.
us. So tell me a little bit more about prostate cancer awareness, and the statistics of it all.
Prostate cancer is, other than skin cancer, the most common cancer that affects men.
Wow.
It's a highly variable cancer. Not all prostate cancers present the same level of risk, but the important point is that early stage disease is silent. So if we wait for symptoms, we're only going to find late stage disease and disease that's already spread into the bones. So in order to find it when we still have good management options, we have to look for it. And that means we have to screen for it, and we use a blood test called PSA, which has been very controversial and a confusing topic over the last many years in order to look for it.
So talk me through the process of these screenings and the blood test, and when do we need to begin?
That's a very important question. There's very good evidence that we need to get a baseline PSA in men in their 40s, and that PSA should be less than 1. If their PSA is less than 1, then their lifetime risk for prostate cancer is quite low. A baseline PSA in their 40s is the best predictor of their lifetime risk for a life-threatening prostate cancer. So I recommend that a baseline PSA be done in their 40s, provided they don't have any other risk factors such as family history or African American ethnicity. Then they can start annual screening at about age 50 or so. And
so what is a common time frame, I guess? So if we get our, our first screening in our 40s, how often do we need to continue that process? And
a lot of confusion and controversy about that. I would recommend that it be done at least once a year.
Okay, so at least once a year. What else do we need to know? Are there any other guidelines or lifestyle changes?
Lots of, well, lifestyle. A heart-healthy diet is a prostate-healthy diet. That's the simplest way to think about it. There's high-level evidence that getting an MRI to investigate risk for prostate cancer is the way to approach this now. We used to do ultrasound-guided biopsies. Many men are terrified of having a biopsy. They've heard about what their friends have gone through. If there's clinical suspicion of prostate cancer based on risk factors, again, such as family history and ethnicity, or an elevated PSA, the best way to pursue this is with an MRI. There are 2 recent studies that show that, that this is an accurate way to select men who are at risk.
All right. And so we do our screenings, we go through the process, and we still end up with a diagnosis. What do we go from there?
If we find it early, we have lots of treatment options. Some prostate cancers are indolent and don't need to be treated, so we put a lot of men on active surveillance. Surgical management with robotic technology is an option. It's been around for about 18, almost 20 years. Other men are treated with radiation and hormonal therapies. The key is to apply the management strategy to the risk presented by that prostate cancer for their natural life expectancy.
So in many ways a customized approach then?
Very, very patient specific, absolutely.
All right, so Dr. Jackson, where can we find some more information about prostate cancer and what we need to keep in mind throughout the years?
There are all kinds of websites available. There's actually so much information it can be a little bit overwhelming, but anybody can search this very easily.
All right. Well, if you want to get in touch with Dr. Jackson and make an appointment for your screening, because if you're in your 40s, it's about that time, right?
Yes, it is.
All right, Dr. Jackson, thanks for joining us. Be sure to visit CHI Memorial online or by giving them a phone call to get your appointment set up. It's better to stay ahead of the game than behind. In the meantime, we're going to keep talking medical. We're going to check in with Susan G. Komen Foundation right after this commercial break. Stay with us.